And many people rely on at-home COVID tests, but be careful because those tests could be expired. And health officials say that may happen sooner than you'd expect.
Charleston Clark found out if the tests are still useful after a few weeks of expiring. She also spoke with a Lowcountry company about the price they're paying by restocking the tests.
Ken Barber is the Human Resources Director for Brightline Extrusions. Since 2020, his company has spent more than $41,000 on COVID supplies.
Whether it's we do a bonus for people that get vaccinated, we provide hand sanitizer, we provide masks, the K95 masks, we do all the cleaning supplies and everything else.
And that also includes COVID tests.
It's easier for us to afford it as a company than it is maybe for somebody to have to go out of pocket or to maybe even miss work for 3 or 4 days while they're waiting on a test result.
Doctors say some of the tests sent out at the beginning of the year by the federal government are nearing expiration. Some have already expired. This has people wondering why such a short shelf life.
Many of us received antigen tests that were stockpiled, made far earlier in the pandemic, and were collected so that they could have enough to have a national distribution of it.
If the test is a little bit past the expiration date, Dr. Thacker says not to worry.
If you're really close to it or you're a few weeks past it, it's very unlikely that that expiration date will impact the usefulness of that test.
As tests expire, new tests will be restocked.
But certainly, as we continue to struggle with COVID-19 cases rising in our communities, there'll continue to be a resupply of these free at-home testings through our Department of Public Health and our pharmacies, as they have been, to make sure that folks that have can use unexpired tests.
Barber says while these tests are costly, he's happy to pay to replace them to keep his team safe.
By being able to help out the employees, by making these kind of things available to them, we've really been able to kind of mitigate any problems that we would actually have with it.
Mental health crisis, you can now call 988 and your call will be answered by a mental health professional. All of the calls in South Carolina are answered by a nonprofit in Greenville County, and they worry with the new hotline that they will not be able to keep up with the demand.
Tara Jabor spoke to the nonprofit about the issue. She also spoke to the South Carolina Department of Mental Health to find out their plan to answer those calls. Tara?
Katie, Tessa, the 988 hotline has been in effect for 10 days. Last week, they were able to answer 700 calls, which is over double what the call center is used to answering.
The Suicide and Crisis Lifeline is now only 3 digits, and as expected, the simplicity of the number has led to more callers.
Our volume has increased 101%, so it's doubled our call volume.
All calls in South Carolina go to Mental Health America, Greenville County. Last week, 923 calls were received, 700 calls were answered, 115 people hung up, and 108 calls were answered by a backup center out of state. But the goal is to have all calls answered in South Carolina.
We would like more people to answer the call here in South Carolina, just because we know our resources here. We know about mobile crisis. We know about the different mental health centers, private mental health places that people can go to.
Mental Health America Greenville County says they have the office space and phones to answer the calls, but they need more staff to meet the demand.
Absolutely, we do need more staff, but we're staffed to the capacity with the dollars that we have.
And they worry more calls are coming next month.
Thanks to the lawmakers, the student IDs this year will have 988 on all of their IDs, 7th grade and up.
The South Carolina Department of Mental Health is working to create a second call center to help answer calls.
It's under development right now. So we have submitted the application to be a certified 988 call center. And this is money that was given from state legislator of $1.3 million.
But it's not fully funded. The Department of Mental Health says they know they need more money, but it's unclear how much until they see how many more calls come in the next few months.
And SCDMH says they're applying for grants to fund the new center in Charleston and will ask the state legislature for more money to fund that second call center. They hope to have it open by early 2023.